Welcome to CUNY TV presents COVID-19, a crisis in motion, a virtual town hall meeting. I'm Mike Gilliam. Since March, we've been under the stress and anxiety that comes hand in hand with the coronavirus pandemic. We've all endured lockdowns, being locked out of our workplaces and working remotely from home. Schools have been closed. The economy is in shambles with sky-high unemployment rates, and the death count and infection rates continue to soar across the country. We've dealt with the depressing daily images of refrigerator trucks awaiting bodies at our hospitals, while COVID patients were being treated in hallways inside. We've watched the numbers of dead on our TV and computer screens while friends died, wondering if I or a loved one would be next. In New York, we have improved, but unlike 9/11 or the 2008 financial crisis, where the event occurred and a rebound began, this crisis, at least as far as the U.S. is concerned, shows no sign of letting up. There's no vaccine, so there's an air of uncertainty. And while we know some things work to fight the spread of the disease, like social distancing and wearing masks, we haven't really dealt with another major potential problem that might be lurking on the horizon: our mental health, which is being affected by all of this. So how are we as Americans coping? They certainly have enough on their plates with coronavirus and the marches and protests against racial injustice and police brutality and a troubled economy. How are our seniors holding up? What about teens and adolescents? How about all of us and the isolation we feel? We have a group of people who are on the front lines when it comes to mental health. Viviane Ouedraogo is an assistant vice president of the New York Founding Hospital and can speak to us about child and teenage isolation. Buzz von Ornsteiner wears many hats. He's a licensed psychologist and has extensive involvement with the homeless and also those who are mentally ill or who have impairments and are involved in the court system. Though he has numerous degrees, he's also currently a student at the CUNY Graduate School of Journalism. Dr. J. Robin Moon works out of St. Barnabas Hospital in the Bronx and is also an adjunct associate professor in the Department of Community Health and Social Medicine at the CUNY Graduate School of Public Health. And Mohini Mishra is managing director of Housing and Naturally Occurring Retirement Communities, or NORCs, and Self-Help Community Services. She deals with seniors extensively. Mohini, let's start with you. What are you seeing with seniors? What are their concerns?
I think, taking into account how everybody is in this together, specifically for seniors, we are not able to do normal things that would bring comfort to them because this pandemic is so engulfing. So we have to kind of make sure, give them certainty during these uncertain times. So I think they are looking for good communications and support while being sort of isolated in their apartments. And the message is that, yes, it's social distance doesn't mean physical distance. Physical distance is there, but you have to be socially connected.
Is it an era of doom, though, with seniors? They see many of their other seniors who are passing away and that sort of thing. Are they very concerned about that on a daily basis?
I think our seniors are more resilient and more, they have gone through a lot of life experiences. So I think we can learn a lot from them. It's normal, aging is, death comes as a normal process. It's the folks who are not dealing with it on a regular basis are more concerned. Yes, it's something that we all grapple with. If we are born, death is the ultimate, end to our being alive. But I think seniors, they take strength from each other, and they're all survivors of all the different life experiences that they had.
Viviane, what about the other end of the spectrum? What are you seeing with our young people?
They're not taking it as serious as they should. So if the families or the adults in the home are telling their children, like we have to stay in, we really cannot be, we have to practice the social distancing, we see a lot of rebelling going on. So they really don't quite understand the magnitude of this. So what we try to do is we try to educate our families as best as we can about being socially conscious around being in the home, even with being in the home and not having to feel cramped with each other, trying to find ways where they can bring in those family traditions that some of us on this panel probably had growing up, whereas a lot of our generation, our youth in this generation now don't even understand what that even actually means.
Robin, talk to me a bit about frontline first responders and people in hospitals and what they're going through, because they're seeing it all. It's right there in front of them every day.
Healthcare workers, first of all, yes, the in-your-face stress, and it's going to be, in the longer term, post-traumatic stress disorder, PTSD. But healthcare workers have seen a lot, and in particular, I want to mention the survivor's guilt. In this case, for the coworkers, I survived. I haven't died, but I have my coworkers literally die in front of me. So that stress and support for that is really critical. And the support really, I think, the city is trying, the state is trying, St. Barnabas is trying. There's some community-based efforts to support, like the mental health hotline and, relaxation tools and such right now. But I believe that they're just too busy to even be able to make 5 minutes out of their day to access it. So these tools and aids that we have right now as an emergency response needs to stay longer.
Buzz, I want to get to you real quick here too, so we can get everybody in very early. Talk to me a little bit about where you see this all going. You've worked with disadvantaged people in the past, people who come from a lower socioeconomic area of our whole environment. Do you see this as being a looming problem in the months and years to come?
It's all kind of happened to us all at once. I guess we're going now on our third month, and it's this feeling of uncertainty. And with uncertainty, naturally, any population that's suffering, and we're all suffering, but we all have different levels of trauma that we faced. Certainly there are people financially who don't know where their next dollar's coming from. And then there's other people who have managed to retain their employment and then are working remotely. I mean, the spectrum is very, very wide. For those individuals, though, who can't pay their rent and are facing the actual possibility of being homeless, this is an incredibly tremendous stressor in their life that's life-changing. If you ever do research or you work, as I have, with people who've gone through wars or had to be in restricted areas or forced isolation, as they have progressed and as they've moved forward, they still return back to that period. They still return back to what they lost. And it's a very, very challenging area in one's life through therapy to try to regain what you've lost.
That's right.
And it's very, very difficult for people to look at their education and saying, what am I losing? Or to look at their lack of employment and saying, how can I support my family? How can I regain employment when we're all in isolation? And for other people who are just looking to have a sense of belonging and are disconnected, how do I get that sense of belonging so I can remain emotionally stable and feel that I'm part of this living, breathing world? So a lot of very, very different challenges that we're all facing and all have different viewpoints. But the one thing in common is we're all faced with this uncertainty and this ongoing frustration.
So one of the things is the isolation too. Do we expect that technology is enough to bridge that gap? I'd like to get you all to kind of chime in on that.
If I could say about the isolation and working remotely, that people do, I mean, it's amazing we have this technology, but for many in the population, the idea of just using things remotely kind of accentuates their loneliness.
So I would say, self-help has technology ingrained in its mission. So we've been working on a platform called Virtual Senior Center for, almost 10 years, where we use Zoom-like capabilities to connect homebound seniors who are no longer able to go out. So learning from that experience, as soon as the pandemic hit, we knew that connectivity, connection, was very important for our seniors. And, people are at different experience level with the use of technology. So we quickly even started simple thing as creating a conference line. Say, for example, our housing residents who are in the housing, all by themselves in their own apartments, with social workers not being on site, family members not being able to connect with them, we created these virtual town halls where people could call in and speak to social workers at a set time. This was in addition to, making sure speaking to each and every single client and giving them the right information.
And how was that received?
Oh, it was very well received because, everybody has a phone, everybody knows how to use a phone. So that was a good comfort level for people to then get used to not having that face-to-face, but over the phone. And then, moving them over to Zoom, with smart, people having smartphones or tablets or iPads.
But what about professional help? Are people reaching out for that in this time? Or are they maybe hampered by a lack of health insurance and that sort of thing?
So I think there is this whole notion and stigma attached to mental health. So if we talk about emotional wellness and reframe it for people, I think it starts from there. And people are, we always say, we are who we are now because of all the experiences that we have lived through. So people are using, going back and opening that toolbox and taking out the tools that they used to come where they are right now. So I think people are connecting. I think this pandemic is making us reset to common sense. What are the basic things that people need? And I think that connection and reaching out, and it's okay to ask for help and, asking questions that you don't know answers for.
Thank God for the virtual technology. It's definitely not optimal, but we're not going outside anytime soon, especially, seeing what's happening in the last 7 days nationwide. This is the best we have right now. And I think, like Mohini said before, I believe the human resiliency and the facility and agency, individual level and community level that we have, it's just really amazing to see. And for the most part, general population, people are adapting, and these tools are being used. And also, even at the ambulatory behavioral health care at the St. Barnabas, we've seen, a lot less no-show virtually for telemedicine, telehealth, telepsych, or even telephonic, just televisit. They're all a little different. The rate has been going up, more patients are being seen. So that's really uplifting to see.
So do you think that telemedicine's time has come here? Is that what we're seeing as far as mental health is concerned?
And it is, like CMS already said, it's not going away. Again, this is here to stay, and I think there's already a lot of effort being done to develop, the regulatory and the actual policies and the technology itself. So that's really, really great to see. But I think I do want to point out again the gap, technology gap, connection, devices, and this goes for all of children education as well. And somebody tech savvy enough to help you connect next to you, and for seniors as well, like Mohini was saying, that agency, the physical, the tools that some people have, not everybody has. So that is actually where we have the problem. That's a social construction of the pandemic. It's not the actual physical isolation necessarily that is driving us mad.
Okay, I wanted to ask another question here just to see what your thoughts are on this. One of the big things as far as like trying to tame this virus is wearing masks and social distancing, but that yet has become a political issue in this country. And there are many people who just refuse to wear the mask. Is that all politics, or is there something else going on in addition to the politics?
Yeah, I actually don't think so. I think we as humans have a need to connect. And after a while, wearing a mask for 3 months with that need to connect, there are certain human traits that just tend to go by the wayside because you're denying who you are and how you meet. Not everyone, certainly after 3 months, many people have kept a very vigilant stance, and you wear the mask and you stay 6 feet away. Generally speaking, probably 70% of the population follow the rules and want to not only protect themselves, but to protect others. But then there's always this 30% or 20% that just cannot keep it up. And there is a sense of sliding and a sense of forgetting and a sense of, I want to belong and I want to see people and I want to live. As dramatic as that sounds, we also saw this with the AIDS crisis when people stopped using condoms, even though they were being given for free. I think initially there was a financial problem with people being given access to masks. And so there were people that were voluntarily going around and saying, do you need a mask? And putting out their own income to provide those less fortunate with masks. So you see that. So you see a lot of people kind of socially helping and conditioning, but there's always going to be a slight part of the population that kind of goes to their own drumbeat.
I think also to add to that, the concept of public good, common good, our American social norm to uplift that, to see it not being there, it's been really interesting because I'm South Korean. I'm a first-generation immigrant from South Korea with my family, and we've all seen, the world has seen how South Korea has been dealing with this, very contrasting. The American individual liberties, without turning this conversation into too political, American individual liberties that we understand, it's not either that or individual freedom taken away. It's actually public good and American individual liberties together. And mask wearing is one such great example. I think that we need more public campaign, PSA to talk about why this public good isn't taking anything away from me. It's actually to benefit 100% of the society. And this is not going to be forever. Let's say for a few months, a year. I think that conversation is missing.
It's almost like they should have some PSAs that show what went on at Elmhurst Hospital when talking about the mask.
Elmhurst?
Yes, the fact that they had such problems there and what went on in the emergency rooms there.
Oh, in the very
people in
beginning.
hallways. Yes, yes.
In the very beginning, yes.
That maybe other people would understand more about what really goes on when this virus takes hold.
Well, in the very beginning, yesterday I counted was 123, day 123 since our lockdown, as New York has gone on pause. And in the very beginning, 120 days ago, and St. Barnabas, no exception, we just had no mask. We had nothing. So, the healthcare workers are wearing garbage bags to cover themselves. They're wearing, the pillowcases over their faces. You cannot breathe in that. And yeah, so that was really, that's federal level, lack of federal response to get the PPE to really essentially where it needed to go. It's not because they did not want to wear them, they didn't have any. They tried wearing garbage bags, and that, we all
that kind of brings me to another question I had for you. I was reading about a nurse who said she was working 16-hour days, seeing all of that pain and suffering in the hospital. And after the 16 hours, she would just walk outside, get in her car, and just stop and cry. Long-term effects to frontline workers on this.
There needs to be support and help. Like I was saying before, the support may be now, may exist right now, but there's no one in the healthcare frontline who has time to get to that. The support that we have right now that we've created as emergency response needs to continue, needs to stay in place. And I also want to say that the disparities, the marginalized population, that's also within healthcare workers. So, medical director at Mount Sinai is not the same as nurse practitioner, frontline ED at St. Barnabas. or even nurses' aide at multiple nursing homes because they don't really have a full-time gig at minimum wage at best, or even worse, actually furloughed healthcare workers who couldn't even go to work. They lost jobs and they didn't get paid at all. So it's not so like your stress is seeing dead bodies in the ED, coming out and crying about it doesn't end there. You come home constantly worrying about, am I infecting my family? I don't have enough space. I don't have enough food to feed my family. And I have to leave my kids without childcare to do this virtual school thing and still go to work for 16 hours again. All those things add up. So, there's, again, pre-existing disparities, even within healthcare workers' world, continues on. So our efforts to address mental health going forward is not, it has to be continuing to address what we've addressed before pre-COVID.
This was a perfect example of how, being a social worker, working for a social service agency, we are big on self-care. So during this crisis, we understood that, this is not like any other crisis where the worker could separate themselves from whatever crisis that they were dealing with. But in here, the workers and the clients were in the crisis together. There was no separation. There was no separation between home and work because you're working from home. So people using those strategies, whether walking to the train station, getting to work, was kind of like a gap between, or a transition between this world and the other world. Everything was blurred. So doing a lot of education and really, really encouraging people to do self-care, compassion fatigue sessions. I know our organization engaged Dr. Buzz to do compassion fatigue, sessions for our staff, for our frontliners, for our supervisors, all different levels, because it's very important to take care of ourselves and then be able to get equipped to take care of others.
Buzz, I was wondering where you might see this all going in the months and years to come, as far as like what types of problems might come up as a result of what people have gone through here, whether you're thinking maybe substance abuse or domestic violence, things like that. What do you expect to see?
When it's really, really true, and I think all of us here would agree, when you're in isolation, it really does the human brain very little good. You really need to converse, you really need to connect, you really need to feel you belong. And reaching out, unfortunately, the coronavirus has stopped that process. We all have a need to connect, and that has been stifled. And there's no indication when that would end. It creates a certain level of uncertainty. And then if you're not seeing a therapist, or you're not connecting with people, or you have no way to stabilize yourself, you do seek out drugs, or you do seek out alcohol, or you do let go of your vigilance to wear a mask or keep separated and possibly engage in sexually compulsive behaviors. It's this acting out behavior that, unfortunately, under the circumstances, can be a normal outlet, a normal result of being so restricted. The other part of this, all this dynamic is, when you're frustrated and you're looking for blame, or you're looking for some reason, your frustration oftentimes turns to depression and then ultimately anger. And that anger can be affected in different ways based on who you are. That anger can be addressed externally to the people you live with, or the people that live in your building, or it can be internalized. And there you have this kind of internalized anger towards yourself. And that's where the levels of potential suicide, or acting out behaviors, or self-damaging behaviors can then show themselves. So many, many, many different outcomes can come from this. Once this is over, and this will be over, once this is over, that uncertainty though, that suspicion, that suspect, possibly that this can happen again, will be with us. And that will be an individual concept for us to handle as individuals and as people in this nation. It can happen again, and there's this discussion that there will be a second wave.
Okay, this is all very concerning, and we won't really know the full extent of any of this damage for years after the pandemic has been controlled and we are back to normal. And we still don't know what the new normal is going to look like and how that's going to affect us. We're living in unprecedented times here. I want to thank our guest, Viviane Ouedraogo, an Assistant Vice President of New York Founding Hospital, Buzz von Ornsteiner, a licensed psychologist with extensive involvement with the homeless and mentally ill who are involved in the court system, Dr. Robin Moon of St. Barnabas Hospital in the Bronx and an adjunct associate professor at the CUNY Graduate School of Medicine, and Mohini Mishra, a managing director of Housing and Naturally Occurring Retirement Communities, or NORCs. Thank you all for taking part in our discussion. I'd also like to thank you all as well for joining us for the special CUNY TV virtual town hall meeting, COVID-19, a crisis in motion. I'm Mike Gilliam. See you next time, and stay safe.